All right, hi there. Following up from last week's live stream on the spine, we're going to zone in a little bit on the neck area or cervical spine. All right, upper spine, neck, neck area. So, just to go over the vertebrae again, we quickly touched base on them last week. There are 7 of them. So, starting up here, you got your C1, cervical one, or your atlas. Then you got your C2 or your axis. The rest are just normal vertebrae. That's your C3, 4, 5, 6, and 7. 7 is a very prominent one. So, like I said last time, if you flex your neck or bend your neck forward, touching your chin towards your collarbone, you can feel C7 at the back here. People with a kyphotic or forward head, military forward head, jutted head posture will have a very prominent C7. All right, so most people you can feel C7, especially if you bend your neck forwards. Okay, so it's a good landmark. All right, now just like the rest of your vertebral bodies, you've got the intervertebral discs as well, which can get damaged or squeezed or pinched, or they can fully herniate, just like the rest of your body. Okay, now let's look a little bit on at the muscles of the neck. Okay, now your main muscle that assists in flexing your neck, so nodding your chin forwards, extending your neck. Okay, so like in looking up. All right, rotating sideways, looking over the shoulder, and then side flexion, ear to shoulder. All right, that muscle is your sternocleidomastoid. Okay, we in physio they will abbreviate it and call it SCM. All right, and basically it starts up here, and actually, sorry, it starts down here and then moves up here. Most of the muscles in the neck either originate down here where the collarbone or clavicle is, and then insert here at the top where the skull starts or where the mandible is, or vice versa. All right, so just in future videos we'll tackle exactly insertions and origins. For now, keep it basic so we can memorize the muscles of the neck. Okay, so that is one of the big major ones to remember. I touched on it last week as well. It's one of the first go-to muscles a massage therapist go to loosen up any tension or residual tension in your neck. All right. Now, second group, on an anatomy chart, they are slightly visible, but they're a little bit more in next to the trachea and or throat area, is your scalenes group. All right. So you get 3 different types of scalenes. You get your anterior scalenes in the front, then you get your middle scalenes, and then you get your posterior scalenes at the back. All right, and they are basically assists in breathing. So they are very, very important to for respiratory function. Now, people with breathing issues or respiratory issues, whether it's anxiety related or whether it's because of asthma, that use their accessory muscles, like their trapezius, for instance, all right, they will have very, very low tone in their scalenes, or they might be very tight at some certain points as well. Okay, so for massage therapists, especially those with a physiotherapy background, it is really important for them also to loosen up these, and that can preferably be done with stretching, or it can be done with certain manual therapy movement, but should be approached delicately. Okay, so that's your scalenes group, aids in respiratory function, so in breathing. All right. Um, Now, the next group of muscles are very, very important. All right, and that is your hyoid group. Okay. So you get 4 different types. You get your thyrohyoid. Okay. You get your omohyoid. Okay. You get your mylohyoid here at the top. And then there's also your sternohyoid. That's the most one here at the front. All right. And what those muscles do is they help with things like swallowing, okay, moving food down your gullet. All right. Um, so just a bit of a self checker for people, for anybody out there, actually young and old. If you wake up one morning and, for instance, you can't swallow, or you take a sip of water and the water comes up through your nose, it is very, very important that you make your way to a medical professional, preferably a hospital or A&E, because that is one of the indicators of something going wrong in the brain, or some sort of a stroke, either ischemic or hemorrhagic stroke. All right, so just keep that in the back of your head. All right, so that is your hyoid group. Very, very important. Okay, that is most of the major muscles um, that we are going to tackle today. Now, why is it important to keep these muscles strong? Okay, first things first. Uh, I'll touch on combat and contact sports. Contact sports such as rugby or gridiron, aka American football, where there's a lot of force from a tackle or from runs, bodies colliding. All right, that can cause a whiplash or damage to the neck, even when they people pile on top of each other. That can damage the neck. All right, so important for that group. Combat sports such as wrestling, where again someone's on top of you, or something like kickboxing or Muay Thai, where you get kicked in the head. Very, very important to keep the neck strong, because it also avoids concussions, or that could contribute shaking of the brain. All right, very, very important to keep this section strong. Um, but also for people who drive, all right, people getting rear-ended or hit from behind, especially if they don't realize it, it can cause a lot of damage in the neck. All right, the neck is also, in conjunction with strength, it's also very, very important to mobilize the neck, which I will show you later with the exercises. And because also you if there's too much tension on the neck, again, it constricts a lot of things. A lot of things can go wrong up here in terms of blood pressure and all that. So it's very, very important to keep the neck loose. Again, coming back to that scalenes group, that anterior, middle, and posterior scalenes of the neck, keeping those loose for good respiratory function. Stretches you can do that a qualified physiotherapist can show you. We're not going to touch on those today, because we're going to focus mostly on the mastoid area and the basic um, flexion, rotation, and side flexion of the neck. All right, flexion and as well as extension, which we will tackle now. All right, so you just to recap: sternocleidomastoid. All right, for movement, basic. Scalenes anterior, meaning front, middle, in the middle, and posterior at the back. All right, uh, aids in respiratory function. Okay, and and then obviously you got your hyoid group, which is very important for swallowing. All right, now the scalenes and the hyoid group will naturally work as well when you do neck exercises, but neck exercises are very intricate and should be approached very carefully. That's why we'll keep most of the movements today, we'll keep basic. All right, I'm not going to zone in on how to stretch the scalenes or anything like that. If you do want to know how to do that, please come and visit our clinic here at the Pain Relief Practice. All right, okay. So I am just going to put this chap aside so it's not in the way. Maybe over there. All right. Okay. Now I'm going to come onto your back. Now I did make a video. It is on our social media about these exercises, which was done on the bed. All right, I'll just explain briefly how that worked again. The bed was basically just there to use gravity as extra resistance. It is not necessary for the average individual to do those. Those are more for people, again, that participate in contact sports, combat sport, things like that, that have a very, very strong neck. All right. There are various devices in the past, things like neck harnesses, where you got your harness over your head, where you attach either like a barbell plate or some sort of weight onto it. I am not a big fan of those because you have to lean forward or back or still be on the side for it to be effective, and it can put a lot of strain on the neck, which is unnecessary strain. There's other ways of doing it. There is a gadget out now where you've got the device putting over the head, which works with rubber bands, where you can practice even in contralateral movement. So in a X, but they can be costly, and again, that's not necessary if you do it right with gravity. Okay, now, without further ado, just to get to the exercises. So, let's make sure everyone can see me. All right, now, first one is flexion and extension. So basically, come onto your back, just keep a little bit of space between your lower back and the mat. Again, I like to do it with my palms up because it keeps my shoulder externally rotated. Of course, we spend a lot of time with our arms internally rotated because of seated positions. Okay, basically what you do is basic ones, flexion, extension. You gotta knot the chin and release back. All right. To add a little bit of resistance, you can knot and up. So you lift the head off the floor. Okay. I call these your yeses because you're nodding yes. Then there is also your nose moving from side to side, shaking your head. Okay. Remember, do these slowly. You don't need to do them explosively. Slow and focus on the movement. Very important is to reach through your fingertips. All right. Coaches call that packing the shoulders, just to keep them away from the ears. All right. It's just better not to overwork the trapezius muscle, the one we discussed last week. All right, that enables your shoulder to elevate in the press. Again, when we in future videos, if we're gonna cover the shoulder, we'll talk about that one a little bit more. All right. Okay, so you got your yeses, you got your no's, and then you have your maybes. All right, maybe I'll do that. Okay, again, reaching through the fingertips. When you do the maybes or the side flexion, try not to lift the opposite shoulder. Okay, it's easy for that to happen. So try and keep your hands still, preferably on the floor, so you can feel if they're moving. All right, I can feel my neck working already. These are great. Okay, the extension one can also be done prone, where you lie like this with your nose hovering above the mat and then lifting up. Again, you need to reach through the fingertips, keeping the palms flat so the shoulder is externally rotated for that to work well. All right. Otherwise, again, the trapezius muscles will do all the work. All right. Now, like I showed about in the video we shot about these exercises to add resistance even more for those who participate in combat sports or contact sports or do whose neck is under a lot of strain. You can do it lying on your bed at home, all right, with your head elevated and off the side. Just be careful, all right? Make sure you are safe. And then you can take it into even more flexion and extension. It's just extra resistance. And now you can also work on the contralateral movement, which is the X. All right. So, like I said, regarding the trapezius muscle, the one that lifts the shoulders up and down, we will cover that in future time when we work on the shoulder more, because it is more important for the shoulder group. The sternocleidomastoid is the big one to focus on, because that does the majority of the head movement. And then you got your scalenes group, and your scalenes group will work with these exercises as well. And these exercises is for anybody. Make very, very sure though that you consult a physician or your therapist before you embark on these exercises, especially if you already have existing neck problems. Reason being, things like tension headaches can be because of pinched nerves in the neck. So you want to make sure that you're all safe when you're doing this. And again, there's a lot going on here neurologically, as well as with your blood pressure, things like that. You got your carotid artery, jugular veins here as well. So those obviously, if they get constricted, there's no oxygen going to the brain, and you will, faint or pass out. So that's your neck anatomy. And if there are any questions, please post them in the chat box so I can get back to you. I have a upcoming webinar today regarding the neck. All right, so we will go through this again, and then also cover neck pain in a little bit more detail, and also what to do for how to manage your neck pain. And if you enjoyed this video, please like and subscribe to our social media. And let's just see, are there any questions? All right, no questions. Please like and subscribe, and I will catch you next week for another live stream. Have a good week, everybody.